Today I'm going to show you the universal Canalith repositioning maneuver for BPPV. We'll be treating the left side. So first I got my patient here. I have a pillow. I always like, you can do this on a bed. I've got my massage table here. But you want a pillow on the end, and your head's going to actually come off the edge of the bed or table or wherever you're doing this. And the idea is that you really have to get the neck extended back in order to have the most effective treatment. So this is going to help kind of create a little more angle whenever we go into our laying down position. So what we'll do is we're going to have the patient being treated. They're going to sit facing away from the edge. So the feet are going to be facing that way. They're going to scoot back towards the edge. You got to get pretty far back. Usually when people think they're far enough, they're not. You're going to come even further back. You got to sit up. Scoot back further. Scoot back a little more. All right, there we're probably about right. So if I'm doing it, I'm supporting them. If you're doing it by yourself, you're just sitting up. Move the head hair out of the way here. All right. So if we're treating the left side, the first thing we need to do is turn our head 45 degrees to the left. And then bring the head back. Keep looking up. Yep, just like that. That's going to be our starting position. And then we're going to lay straight back down, maintaining the neck in this position the whole time. So always count down, 3, 2, 1. Here we go. Come on back, come on back, come on back. And see how the head is extended back. We want it extended nice and far. We're going to maintain that position for 1 minute. So I'm not actually treating her, so we're going to pretend like a minute just passed. The next position is you turn your head to the right so that you're looking 45 degrees to the right, maintaining the head back. 1, 2, 3. Turn the head to the right. It's a little bit harder with someone who has limited neck mobility, like we got here. So if you have that, a quick neck manipulation would usually correct that and give a little more space for turning, or maybe a mobilization in the cervical neck, but we'll not worry about that today. You will hold this position for 1 minute as well. So with the first position, you're probably going to have symptoms. They should go away. Even if they go away, I would still hold the position. Don't move yet. Just keep it in that position. Same thing here. If you have symptoms again, keep in that position for at least a minute. You can go up to 90 seconds if you want to. From here, you're going to lay on your right side and prop up on your elbow. So I help the patient get on the right side, roll, roll, roll. Up on your elbow. Nope. Up on your elbow. I hold their head. Their goal is to be at a 60-degree angle from the horizontal is your goal. You're going to hold that for a minute to 90 seconds. The whole idea of holding it for a long time, what we're doing is repositioning crystals in the inner ear. Those crystals are different sizes. Some of them settle in the fluid more quickly than others. So we want to give enough time for everything to settle. After this position, you're going to go lay on your stomach and tuck your head. And when you're on your stomach, your head is off the edge of the bed or table or wherever you're doing this. Go ahead and go on your stomach. On the way, come forward, come forward, come forward, come forward, come forward. And tuck the head. It's a bit hard to see with the hair here. Oop. So, tuck down, holding that position for 1 minute to 90 seconds. This position should feel the best out of all the other positions. Usually by this point, things are a little bit settled and starting to feel a little better. You'll hold that, and then you will sit up on the edge of the table or bed. So go ahead and sit on up. Keep your head tucked as you're coming up. This is easier if you have short hair. And you're going to hold that position for another minute. And then you'll slowly look up. I like to have somebody with me because you can still feel dizzy. So it's nice to have somebody who can kind of have their hand on your shoulder. You can also get nauseous and throw up. So it's good to have a trash can nearby or a bucket or something to throw up into if needed. So, and then after 60 seconds, you're going to look up. All right. That's one time, one treatment. I would do 2 to 3 in a row just to make sure you get everything. Waiting that 1 minute to 90 seconds in each position. And then afterwards, you're going to want to do some exercises. And bring a pen over. Do you have a pen? All right, I'm going to do 3 types of exercises. I usually like getting a playing card. The playing cards are really nice because you can look at the hearts or look at the spades or look at the clubs. If you don't, you can just get 2 regular cards and just put an X on them. Here I have an X. So it just gives you something to look at. You can either tape it on the wall or hold it up in front of you. The first exercise, your eyes stay focused on the X. Rotate your head back and forth. You want to do it at a speed you're almost getting a little dizzy, but not quite. So it should be just on the edge of what's comfortable. You'll do side to side. I think starting out, a lot of times doing it 10 times side to side, and then you'll do head nods up and down. Same thing, eyes focused on the X. Up and down. Next one, you're going to do head turns, and you're going to move the card. So you'll move the card the opposite direction of your head turn. So I can start, and then bring the card movement into it. The X or the club or the heart should always stay in focus. If it starts to get blurry, then you're going too quickly. You need to slow it down. Do the same thing up and down. Head goes one direction, card goes the opposite direction. Eyes follow the object. All right. So that's the second exercise, 10 times each direction. And then the last one, you're going to have 2 cards. You're going to hold them up or tape them on the wall, whichever is more convenient for you. You're going to start with your head facing forward. You're going to be looking straight ahead. Then your eye is going to go towards one card. Mine's going to the right. Then you point your nose towards that card. Then your eyes go towards the left. Then you point your nose towards the left. Eyes go towards the right. Point your nose, eyes, nose, eyes, nose, eyes, nose, eyes, nose, eyes, nose. 10 times side to side and 10 times up and down. So eyes, nose, eyes, nose, eyes, nose, eyes, nose. Same thing. those 3 exercises. I think starting out maybe like 10 times each is good. If you can do each one for a minute, that would be even better. If you start getting kind of an increase in dizziness or uneasiness or nauseous, then you need to stop. You're not going to push through that. As soon as you get to the point where you kind of feel that, you stop those exercises. Those exercises perform 2 times a day, once in the morning, once in the evening, for at least 2 weeks. Once you do the positional maneuvers, you shouldn't have to redo those unless you have issues on the other side. And then I would wait at least a day to determine that. The first time you do the positional maneuvers, you're probably not going to feel great. I usually tell people to take it easy the rest of the day. Sometimes people go take a nap and then they feel a lot better after that. Sometimes it takes till the following day to kind of feel better. But that is the general routine and a good way to start out with taking care of BPPV for the left side.